We use the Measura protocol, which is a very specific protocol on cognitive health. It's a very specific protocol on metabolic health. And we use Measura.ai to help guide us for these patients. But the key element is appropriate testing so that you don't have issues with your patients. And I'll go through that in depth at a later time. But essentially, there's so many different things that the patient can have. Like, for example, if they have an upper respiratory tract illness, do they have a mycoplasma? Is it virus? Is it a bacteria? All of these are possible. Did you check the patient for TB? Did they get immunosuppressed and reactivate their TB? You don't know any of this. And so getting the appropriate testing is absolutely necessary. And screening the patient in advance is absolutely necessary. And monitoring what's in their blood or their urine and matching it up to what their prescriptions are is absolutely necessary. Because you don't know which patients are trading meds. You don't have any idea. In fact, in St. Louis, one of our nursing homes had about 8 deaths in it from fentanyl overdose. Oh, how did these patients end up with fentanyl? Turned out it was one of the workers. And they were trading out the patient's prescription narcotics for fentanyl because they could sell the prescription narcotic on the street for more than the cost of the fentanyl. They could sell that hydrocodone or Percocet for $20 a tablet, and they could buy the fentanyl for a few bucks a tablet. So they were shaving the fentanyl and giving it to the patients. Unfortunately, the dose was too high and several patients died. So these are things that are important to consider. Compliance monitoring is critical, and sometimes we rely on urine. But do I really want to watch that patient pee? I mean, if I can get the same data from a saliva sample, that might be better. And that's what we try to do. We want to have compliance, and we don't necessarily want to watch the patient pee. We want to get appropriate blood testing, and it's monitored collection rather than just allowing it to be collected. Because if you allow it to be collected, there's a possibility that you're not even getting the right patient's urine. It's too contaminated, or there's other issues. Now, there's urine that you need for urinary tract infection, but that's different than therapeutic monitoring or compliance or urine toxicology. We use advanced genetic testing to identify pathogens because the days of culture insensitivity, they're gone. There's just too much data out there that shows that you miss 30, 35, 40% of what's in a bacterial culture if you're just relying on culture insensitivity, and the time frame is too long. I can quicker get a quant TB for tuberculosis than I could possibly get to grow the tuberculosis or do an acid-fast bacillus stain. It would take me 4 weeks to get an AFB stain, and I could have a quant TB back by day after tomorrow. And I would know if that patient's mitogen positive for TB rather than waiting. Because the PPD, the skin test, doesn't count. The patient could be allergic. You have no idea. And so you want to be highly sensitive and highly specific. And the same thing with the respiratory pathogens, and the same thing with the urinary tract pathogens and the STDs. Therapeutic monitoring is critical. It's not just toxicology. What happens if somebody's blood sugars are really high and they're not getting their insulin, but we all think that they are? That could be a problem. What happens if somebody is selling these on the street? You wouldn't know it. And if you don't measure the therapeutic level of insulin in that patient with a low C-peptide but a high insulin level to document that the patient's actually been getting their insulin, then you got a problem. And so what happens if they're not getting their blood pressure meds? What happens if they're not getting their trazodone or their Ambien or whatever other medication, and things that you wouldn't even think are diverted but are? These are big deals. I mean, for God's sakes, they're selling glucose strips on the street corner. You gotta wonder, why would somebody buy glucose strips? They're buying insulin the same way. You can buy it on eBay. So these are all things that are of concern, and that diversion risk is not inconsequential. We want to look at pharmacogenomics. As people age, their use of medication changes, and certainly their metabolism in their liver and kidneys change. And the polypharmacy that goes on can be really a problem. So we want to look at that genomics to make sure that the medications the patient's currently on match up with their liver functions and match up with their with their genetics, so that there isn't some contraindication, and that's not why they're having outbursts or something. We want to look at neurodegenerative issues, because if we get ahead of those, we can really reduce the burden to healthcare. You could save $85,000 to $88,000 a year in just medication costs if you can figure out what kind of neurodegenerative issues there are. And neurodegenerative is closely linked to metabolic, and that's what Measura measures. That's what Measura manages, and that's how we get ahead of this issue. We've created an entire system around Measura, and we'll talk a little bit more about it, but it's a metabolic profile, and it generates revenue for the facility, about $1,070 to $1,050 per patient per year, and then the behavioral health component of it generates another $2,000 to $3,000 per patient per year. So it's not chump change. It gives you definitive treatment options that you wouldn't normally have. We've combined value-based engineering with an artificial intelligence that aggregates data and specifically addresses issues that are metabolic in this population and allows you to get ahead of the situation.